Dr. Roshan Jain. I'm one of the senior psychiatrists at Apollo Hospitals in Bangalore and also with Doc Genie. I have over 25 years of experience of working in India and in UK in general psychiatry, in addiction, in psychotherapy, teaching, and motivational work. Uh, I've had a deep interest in raising awareness about mental health, reducing stigma, and hopefully enabling people to seek early access for very much needed treatment. And I think I have been successful at many of these aspects. Mindfulness has many definitions, and in simplest way to describe it is being mindfully present or being in the present moment, or and being aware of your thoughts, your feelings, your emotions, and your behavior and interaction with the world around you. And that's what mindfulness means: is being aware and knowing yourself and your thoughts. One of the most important aspects of understanding your problem, whether that's psychological problems or relationship problems or mental health problems, is to be aware of it. And mindfulness simply teaches you, enables you to become aware of your emotions, because awareness is a prerequisite for any remedy or change. So when we talk about mindfulness, you're helping people to take cognizant of the thoughts and feelings and how it impacts yourself, importantly, but also how it impacts others and your relationship. So if there are techniques, and in East, we have always practiced mindfulness, then you are better able to handle your emotional as well as physical well-being. There are many different ways of being mindful. In the Eastern practices, we always taught people about doing yoga, about doing meditation and pranayamas, and about doing body scans or shavasana. And yoga simply is not a physical activity as they now show it in the West, but it is a technique or where you use postures in a mindful ways by becoming focused on the body parts that you're stretching and engaging in. And that becomes very meditative. When you sit down and do pranayama or breathing practices, as they call it, then you are becoming more aware of this essential life energy called the breath. And when you take cognizance of the breath, you feel alive, you feel aware. And with repeated practice of pranayamas or breathing techniques, you start to become more aware of yourself, of your body, and of your thoughts. With the body scan, as you know, that we sort of sit down and scan the different parts of the body. Again, simply to be present with your body, to be present where your body is. And often on it happens that our minds and our bodies are now two separate entities. Where our body is, our mind is not. And mindfulness brings the two together in one place. You can also use other techniques of mindfulness. For example, music. Listening to music is becoming mindfully present. Playing musical instrument is mindful presence. Artwork and sketching, painting, drawing is all mindfulness. Sometimes just sitting in the garden and being observant in a non-judgmental way is mindful. Bird watching, as they call it, is mindfulness. Unfortunately, the simple things of daily life we've forgotten. And I think if we start doing one thing at a time, properly, mindfully, being there at that point in that time is mindfulness. And it can be done in every aspect of your life. Yoga and meditation teaches you to be present in whatever you're doing, whether you're eating, whether you're watching television, whether you're reading a book, to be present where you are, mind and body in one place. I want to emphasize that we need to look out for ourselves, our well-being. We need to give equal importance to mind and body because they don't look out for themselves. So we need to invest and take care of ourselves. With that, I'd like to thank you. Have a good day. Be healthy.